Hello, my name is Jennifer Shelton. I'm a registered nurse and I work at Tug River Health Clinic in Gary, West Virginia. I'm also a Bluefield State nursing student in the RN to BSN program. For my Senior Change project, I've decided to create a diabetic nutrition patient education packet. The goal and objective of my project, the goal was to create a diabetic nutrition information packet for our patients and their family members in a rural community clinic setting. The objective was to develop the diabetic nutrition education information packet by the date of October the 28th, 2018. And this would be used to provide patient teaching at Tug River Health Association in Gary, West Virginia. The problem that was identified is there is a growing rate of patients being diagnosed with diabetes mellitus. And of these patients, specifically at our clinic, there's an overwhelming number whose diabetes is uncontrolled. There were some restraining forces identified for the project. This may be a lack of patient motivation or participation in the teaching, a lack of staff participation, or the ability to train the staff on how to correctly use the patient packet to provide education in the best way possible. Some of the driving forces for the project was the need to help our patients control their diabetes. Controlling their diabetes will help them prevent future complications or will help with any other medical conditions that they may have. It also allows them to learn self-management skills, and these are skills that they do on their own at home, such as knowing the right foods to eat, checking their blood sugar as they are directed, and taking their medicine as prescribed. This will also improve the quality and consistency of the teaching material that we use to provide the teaching to our patients to help them better understand. A description of the environment. Tug River Health Clinic is a community health clinic. It's a nonprofit agency and it's governed by a community-based board. We provide quality health care and dental care to patients no matter their ability to pay or no matter their income or insurance. We have 5 locations within McDowell and Wyoming counties. This is a picture of our main location located in Gary, West Virginia. At our main location, we have 6 exam rooms, 1 ER room, which is like our trauma room. We have a laboratory where we do both in-house and send-out testing. We have an x-ray department, we have a pulmonary department, and we also have 3 dental exam rooms. At the main location in Gary, we have a nurse practitioner, a nursing supervisor, a care manager, which is myself. We have a triage nurse, a laboratory nurse, an x-ray technician, multiple front desk staff, multiple billing staff, dental staff. We have a black lung program. We also have management and administration. And on Thursdays and Tuesdays, we do have an additional physician and triage nurse at this location. So what would be the benefits of the creation of a diabetic nutrition education packet for our patients? First off, it's going to provide useful information. The organization of the patient packet will allow for better understanding of the information for our patients. It was also written at a reading level that is easily understandable. It contained many images, pictures to add to the information that was contained within the patient packet. Everything was bullet points, and it was based off of questions, such as a patient may ask, what should my blood sugar be? What type of food should I eat? So it was organized where it was in the form of a question and the answers were in bullet points. It was created so that it could be individualized for each patient that we provided teaching for, and we had input from the Tug River Health Association staff as to what they thought would be the best information to include for our patients. I started the project by doing a needs assessment. And this was a questionnaire that I passed out to 10 people who all responded. The questions on the needs assessment were, do you think we have adequate nutrition information for our diabetic patients and their families? 80% of the 10 people who responded to the questionnaire said no, that we do not, that there was room for improvement. What information do you feel is the most important information to include in patient and family teaching regarding nutrition concerns of diabetic patients? 70% said portion control, 80% said carbohydrate counting, 40% said sick day rules, 70% said carbohydrate identification, 30% said the My Plate method, 70% said snacking, 80% said eating out, and 10% said hypoglycemia treatment. The last question on the needs assessment was, would you be willing to be on a committee to provide feedback and evaluation of the creation of a diabetic nutrition education packet that will be used when providing diabetic education to our patients and their families? 90%, so 9 people out of 10, agreed to be on the committee. Here's our committee. It was formed with nursing staff, providers, members of administration and management. There's also 2 people missing from the photo. One is a doctor and the other is a nurse. The action plan. This is how we decided to implement the diabetic patient education packet. We said that it would be to provide education for newly diagnosed diabetics. It would be used to provide education for anyone who is uncontrolled, no matter how long they've been a diabetic. It would also provide continuing education for all patients with diabetes or pre-diabetes and their families. So that part actually focuses on the prevention. And it would be used as an at-home patient resource that they could take home with them, refer back to, and then of course contact us with any questions. Guidelines for implementing the project were first to identify the patients. So we wanted to identify patients who were diabetic or pre-diabetic, whether they were uncontrolled or not. We wanted the provider to create a referral for a diabetic nutrition education. After this was done, the care manager, which is myself, would provide education using the diabetic nutrition education packet, and then either myself, the care manager, or members of the nursing staff would follow up with the patient either at a soon upcoming appointment, or if they're a patient that may be only seen every 3 to 6 months, we would contact them by phone to follow up and see how they're doing with the education that was provided to them. So we had an in-service at the Gary location on October the 25th. We had attendance from staff from all 5 clinic locations. So this is the one time a year that we have everybody together all at one site. I use this opportunity to provide everybody on the update of the project, and then we determined that we would have a go live date of November the 19th, which would be when we would start using the diabetic patient education packet. So after its implementation, what worked well? The nurses and providers were very excited with the use of the educational packet. Patients who were provided with the education were very receptive. They asked questions. They seemed enthusiastic. It was used very frequently because at Tug River we have a large number of diabetic patients. And goal setting was utilized and was helpful, and this is how we individualized the teaching to the patient. So we had them set goals for how many times they would check their blood sugar or what they wanted their blood sugar to be, their A1C goal, things like that. What did not work well? We chose a go live date that happened right after we had a new release of a new EHR. So we were learning a brand new workflow, learning a brand new system, learning how to document. So it was a very busy time for us, which allowed for not the best time management. And then also during this time of the year, we have a lot of people calling in sick, so we had some short staffing. So there wasn't always somebody there to be able to provide the education when we need it. I believe managing diabetes is not a science, it is an art. And with the proper education for our patients, they can help control their diabetes, prevent complications, and maintain an overall better health. Again, my name is Jennifer Shelton from Tug River Health Association. I'd like to thank you for watching my presentation today. If you have any questions or concerns, please feel free to contact me. My contact information is listed on the board. And again, thank you so much for watching.